We know having a lumpectomy can be scary, but at the Iowa Clinic, we're here to help you understand the steps before, during, and after your surgery so you can know what to expect.
We perform this procedure as part of the Iowa Clinic Surgical Breast Clinic, so you'll receive expert coordinated care from our medical imaging, general surgery, surgical oncology, and pathology departments. In this video, you'll hear from radiologists Dr. King and Dr. Andrick, surgeon Dr. Hamling, a former lumpectomy patient Denise, and me, Jackie, a breast care navigator. We'll walk you through the steps of your lumpectomy, before surgery, day of surgery, and what to expect at home. Our goal is to help you feel comfortable and ready for your surgery.
As a breast cancer survivor, I understand you might feel nervous right now, but my team at the Iowa Clinic made sure everything went smoothly and quickly, so I didn't have to wait around wondering about what was next. They were there for me every step of the process, just like they'll be there for you. You're in good care.
So, you need a lumpectomy because you had an abnormal mammogram that required a biopsy. Based on your biopsy results, it was determined the abnormal breast tissue needs to be removed. This is what you can expect before your lumpectomy.
Your team will call your insurance to pre-certify the surgery, but it's your responsibility to understand your insurance benefits, including what's covered and what out-of-pocket costs you can expect.
Then you will have a consultation with your surgeon, where you will review your biopsy findings, have a breast examination, and learn more about your upcoming surgery. During that appointment, we encourage you to ask any questions you may have. You'll leave your surgery consultation with your surgical date and check-in time for your sentinel lymph node biopsy and/or needle localization, which you'll learn more about in this video.
Within 48 hours of your surgery, Lakeview Surgery Center will call to tell you your exact procedure time. Or if you're enrolled in One Medical Passport, you'll get a message with your surgery time by 12:30 the day before. Before your procedure, you'll need to do a few things to prepare. Don't worry, you'll get a handout that explains this in more detail. But it includes stop using aspirin 1 week before surgery. Don't eat or drink after midnight the night before or on the morning of your surgery. Bring your insurance card as well as a list of your daily medications, highlighting any blood thinning medications you may take.
And you want to be comfortable, so bring a sports bra with good support and wear an oversized button-up or zip-up top. You'll also want to remove any makeup, jewelry, nail polish, contacts, or dentures before surgery. I also took some reading materials with me on the day of my surgery, so I had something to do while waiting. I suggest you do that too.
Now, depending on your biopsy result, you might need a sentinel lymph node biopsy injection. If so, this will be done in our Iowa Clinic cardiovascular department, since that's where the equipment is. This injection goes into the area around the abnormal breast tissue and allows your surgeon to see and remove your sentinel nodes during your lumpectomy. Removing these nodes allows us to test them to see if the cancer has spread beyond the breast.
After this injection, or as the first step, if you don't get the injection, you'll go to our medical imaging department at our West Des Moines campus for a mammographic needle localization. You may have to wait after your injection and before the localization. For this step, we use a mammogram to locate the tumor and then insert a thin needle. We'll use this as a guide to find the precise area that needs to be removed during surgery. This procedure uses local numbing medication, so you'll be awake and upright. We'll place a cup over the area, and then you'll need a driver to take you across the street to Lakeview Surgery Center for your surgery.
Depending on how many surgeries there are that day, there can be some waiting involved, but please don't go home because we don't want the needle to move from where it was placed. At Lakeview, enter through the lobby and check in with the receptionist. When it's time for surgery, your nurse will take you back to the room.
Once under anesthesia, your surgeon will inject blue tracer dye behind the nipple and make an incision to remove the tumor. They'll remove the abnormal tissue and some surrounding margin tissue, as well as the sentinel lymph nodes as identified by the sentinel lymph node biopsy injection in step 1 if this applies to you. Then they'll close your incision using sutures, adhesive strips, and/or glue with special attention given to preserve your breast's appearance. In general, this surgery usually takes an hour and 15 minutes to an hour and 25 minutes. Then we will send your tissue and lymph nodes to the lab to be analyzed.
After your lumpectomy is finished, you'll be taken to the recovery room where you'll wait around 30 minutes to an hour after you wake up. Then we'll take you to your discharge room where you'll see your family member and surgeon who will explain how the procedure went. You'll need a driver to get home.
Speaking of home, you're probably wondering what to do after your surgery. I know I did.
Your handout will explain more, but some of the main tips include wear a supportive bra or sports bra to help reduce your discomfort. Use an ice pack. Do not drive or perform any skills requiring coordination. Eat and drink normally as you can tolerate. Keep your incision dry for at least 24 hours, and tell your doctor if you notice swelling or drainage or if you have a fever. As far as medication goes, you can alternate between Tylenol and ibuprofen. Your surgeon may also prescribe you pain medication. Then within 1 to 2 business days, you will discuss your pathology results with your surgeon to determine next steps and possible options for treatment if needed. We'll also schedule your 2-week follow-up appointment on that same phone call.
After this, your follow-up depends on whether your results showed cancer or not. If no cancer was found, you'll usually go back to routine screening.
If cancer was found, you'll typically have a follow-up at 6 months with a 3D diagnostic mammogram, a follow-up at 1 year with a bilateral 3D diagnostic mammogram, then follow-ups at 2 and 3 years with diagnostic mammograms, and where high-risk patients alternate high-risk screening MRIs and diagnostic mammograms every 6 months. At 4 years and beyond, you'll be back to screening mammograms. You'll also see your surgeon for 3 years following your surgery at an interval determined by your surgeon.
No matter what, your team at the Iowa Clinic is here for you before, during, and after your surgery.
We want to help you feel in control and as comfortable as you can throughout the entire process.
If you have any questions or concerns, please ask your care team. They're happy to go over anything that's on your mind.
I'm so glad I chose the Iowa Clinic for my breast health. My doctors, nurses, and care navigator always made me feel listened to and cared for. With the Iowa Clinic on your side, you've got this. I know you do.